NCLEX RN National Council Licensure Examination Exam Practice Questions. Question 1. Set 1, which is a common side effect of radiation therapy to the head and neck: diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 2. Set 2, a client is diagnosed with peripheral arterial disease, PAD. Which symptom should the nurse expect? Dependent rubor, painless ulcers, bilateral edema, warm skin. Dependent rubor, redness when legs are down, is a common sign of PAD. Question 3. Set 3, what is the diet recommended for a patient with diverticulitis in the acute phase? High fiber, NPO or clear liquids, high fat, low protein. During acute diverticulitis, bowel rest, NPO or clear liquids, is necessary to allow inflammation to subside. Question 4. Set 4, which electrolyte imbalance is associated with Trousseau's sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klostek's signs indicate hypocalcemia. Question 5. Set 5, which is the correct order of the nursing process? Planning, assessment, diagnosis, implementation, evaluation. Assessment, diagnosis, planning, implementation, evaluation. Diagnosis, assessment, implementation, planning, evaluation. Evaluation, implementation, planning, diagnosis, assessment. ADPI assessment, diagnosis, planning, implementation, evaluation. Question 6. Set 6, which lab value is elevated in acute pancreatitis? Serum amylase, BUN, hemoglobin, potassium. Serum amylase and lipase are significantly elevated in acute pancreatitis. Question 7. Set 7, which condition is characterized by current jelly, stools, celiac disease, intussusception, Hirschsprung's disease, Crohn's disease. Intussusception causes stools mixed with blood and mucus, appearing like currant jelly. Question 8. Set 8, a patient is scheduled for surgery. When should the consent be signed? In the OR, after the sedative is given, before any preoperative medications are administered, in the recovery room. Consent must be signed while the patient is alert and not under the influence of mind-altering drugs. Question 9. Set 9, a child is admitted with tetralogy of Fallot. Which position helps during a TET spell? Supine, knee-chest position, prone, side-lying. Knee-chest position increases systemic vascular resistance and improves oxygenation during cyanotic spells. Question 10. Set 10, what is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 11. Set 11, a patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 12. Set 12, a patient has a suspected fracture. What is the first priority? Administer pain medication, immobilize the limb, apply ice, obtain an X-ray. Immobilization prevents further tissue damage and reduces pain. Question 13. Set 13, a pregnant woman is at 32 weeks gestation. Which sign should she report immediately? Leg cramps, blurred vision or headache, backache, frequent urination. Blurred vision and headaches are signs of preeclampsia. Question 14. Set 14, which EKG change is most indicative of a myocardial infarction? PR interval of 0.16 seconds, ST segment elevation, T wave inversion, presence of AU wave. ST segment elevation indicates acute myocardial injury. Question 15. Set 15. A patient with alcohol withdrawal is tremulous and agitated. What medication is usually prescribed? Disulfiram, chlordiazepoxide, methadone, bupropion. Benzodiazepines like chlordiazepoxide, Librium, are used to manage alcohol withdrawal symptoms. Question 16. Set 16. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 17. Set 17. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 18. Set 18. A patient is taking warfarin. Which lab value should be monitored? APTT, point/INR, platelets, WBC. Point/INR is used to monitor warfarin, Coumadin, therapy. Question 19. Set 19. What is a classic sign of appendicitis? Left upper quadrant pain, rebound tenderness at McBurney's point, pain relieved by eating, hematmesis. Pain in the right lower quadrant with rebound tenderness, McBurney's point, is classic for appendicitis. Question 20. Set 20. A client has a chest tube. The nurse notes continuous bubbling in the water seal chamber. What does this indicate? Normal function, an air leak, the lung has expanded, the tube is occluded. Continuous bubbling in the water seal chamber indicates a leak in the system,